What would you do if you saw tears flowing from a marble statue? Dr. Michael Thompson thought he was hallucinating from exhaustion until he touched the Virgin Mary's face and felt the warm tears on his fingertips. But that was just the beginning of what happened that night in a small Kentucky hospital room. Room 237 at St. Mary's Children's Hospital in Louisville showed 2:47 a.m. on the digital clock. Only the night shift nurse's footsteps echoed through the corridors, accompanied by the distant sound of ambulance sirens. The hospital's fluorescent lights cast a cold brightness on the sterile white walls. At this hour, the hospital had a quiet but tense atmosphere, far removed from the daytime hustle and bustle. Dr. Michael Thompson, 42 years old, was an experienced pediatric oncologist who had been working for 15 years. Standing 6'1" with brown eyes and prematurely graying hair, he had a serious yet compassionate appearance. He always carried a Mickey Mouse pen in his doctor's coat pocket to make his young patients smile. But facing Emma Rodriguez's condition, despite his 15 years of experience, he felt completely helpless. Emma Rodriguez was only 7 years old. With her curly brown hair, large brown eyes inherited from her grandmother, and a face that smiled even in the most difficult situations, she was beloved by the hospital staff. The nurses called her Little Angel. But the severe headaches and seizures that began 6 months ago had revealed the most terrible truth: glioblastoma multiforme, the most aggressive type of brain tumor seen in children. And unfortunately, it was in its final, most lethal stage. Since her diagnosis, Emma had undergone 3 surgeries, countless chemotherapy sessions, radiation therapy, and tried experimental drugs tested in only a few centers worldwide. But none of it had worked. The tumor continued to grow and spread, and now they could only sustain her with painkillers. Dr. Thompson, reviewing Emma's thick file for the 100th time, noticed her mother dozing in the chair beside the hospital bed. Sarah Martinez, 34 years old, was a strong mother fighting alone. Short in stature, dark-skinned, with black hair always pulled back, Sarah had lost 10 pounds since her daughter's illness began. The dark circles under her eyes testified to countless sleepless nights. Emma's father, Carlos, had disappeared just 1 month after the diagnosis. He had packed his bags saying, "I can't handle this burden," and left, never to be heard from again. Sarah, however, had sacrificed everything for her daughter. She quit her nursing job, sold her small house, got rid of her car, and spent every last penny on Emma's treatment. Now she survived only on government assistance and donations from the church. But Sarah's greatest comfort was her unwavering faith. The Virgin Mary statue inherited from her Mexican grandmother Esperanza was always by her side. Small but carefully crafted, the white marble statue depicted the Virgin Mary in a blue cloak with her hands open. This approximately 6-inch statue was a special piece that Esperanza had acquired from a monastery in Mexico City in the 1920s. Before she died, Esperanza had told Sarah, "Mija, this statue is not just stone. This is our family's protector. In every difficult time, in every moment of pain, kneel before her and open your heart. She will hear you. She will never leave you alone." Dr. Thompson, on the other hand, was a man who, in his 15-year medical career, believed only in science, proven treatment methods, and clinical experience. A Harvard Medical School graduate who specialized in pediatric oncology at Johns Hopkins, published dozens of articles in prestigious journals including the New England Journal of Medicine, and gave presentations at international conferences. He was a successful doctor. He respected religious beliefs and understood the spiritual needs of patients and their families. But he never believed in miracles or supernatural powers. To him, everything had a logical, scientific explanation. Disease, treatment, recovery, or death, all could be explained within the framework of medical rules. But Emma's case had deeply affected him. Perhaps it was related to the child's age. Perhaps it was her fighting spirit. Or maybe it was the struggle her mother was putting up for her. Whatever it was, this case had shaken Dr. Thompson both professionally and personally. Chemotherapy, radiotherapy, surgery, immunotherapy, experimental drugs. They had tried every treatment option available in pediatric oncology, but none had been effective. Against Emma's aggressive tumor, the tumor continued to grow, and now they could only provide palliative care, pain relief, and comfort measures. Dr. Thompson had been forced to tell Sarah several times that, unfortunately, there's nothing more we can do medically. Forming this sentence tore his heart apart every time. As a doctor, this was his greatest nightmare, being unable to help a child. That night, when Dr. Thompson entered Emma's room to do his final check, he encountered an unexpected scene. The room was illuminated by the warm yellow light of a bedside lamp. On the walls were Emma's drawings, cards from friends, and small toys gifted by hospital staff. The window overlooked the hospital garden, peaceful and calm under the night lighting. But what caught Dr. Thompson's attention was something else. Sarah was kneeling on a small rug spread on the floor beside the hospital bed, silently praying. In front of the Virgin Mary statue, tears streaming from her head flowed down her cheeks. Her hands were clasped to her chest. Her lips were moving, but no sound came out. Dr. Thompson stood frozen at the threshold, watching this intimate scene. Sarah's desperation and simultaneously unshakable faith had deeply moved him. He could see the pain she was suffering as a mother, but at the same time, he respected the spiritual strength she found in the midst of this pain. "Holy Mother Mary," Sarah whispered, her voice trembling, "I ask only for one miracle from you. I don't want anything else. Save my Emma. She's still so young. She has so much more to live. She still has to go to school, make friends, maybe one day become a mother. Don't let this disease deprive her of these opportunities." Sarah's voice became hoarse. "If someone has to suffer, let me suffer. Let me be sick instead of her. But please, help her. The doctors have done everything they could. Now only you remain." Dr. Thompson felt uncomfortable being a witness to this emotionally charged moment. This was a private, personal moment, but at the same time, he could see the power of Sarah's faith. This faith was the only thing keeping her standing. Medically, there was nothing left to be done for Emma. MRI scans showed that the tumor had spread to the brainstem. The statistics were clear. At this stage, the average life expectancy was 2 to 3 weeks. Perhaps he needed to explain this reality to Sarah more clearly and openly. But how? How do you tell a mother about her child's death? He decided to enter the room quietly. He walked on tiptoe, but the wooden floor creaked. When Sarah noticed him, she quickly stood up and tried to wipe the tears from her eyes. "Dr. Thompson, I'm so sorry. Did I wake you? Did I disturb you?" "No, Mrs. Martinez. I was already awake. I was doing night rounds. I came to examine Emma." Sarah nodded and took a step back. Dr. Thompson checked Emma's pulse, examined her pupils with a small penlight, and listened to her heart rhythm and breathing sounds with a stethoscope. All findings were as expected, but unfortunately not positive. Emma's condition was worsening. Her pulse was low but irregular. Respiratory rate had decreased. These were signs of the final stage. "Doctor," Sarah said, with a noticeable tremor in her voice, "Emma said very strange things to me today, things she's never said before." Dr. Thompson hung the stethoscope around his neck and focused on Sarah. "What kind of things? How strange?" She said there was a woman in the room, a woman in a blue dress, very beautiful, and she claimed this woman told her not to be afraid, that everything would be all right. Dr. Thompson frowned. Unfortunately, this was a fairly common condition in brain tumors. Tumor growth could affect the brain's visual cortex and temporal lobes, causing visual and auditory hallucinations. "Mrs. Martinez, I'm sorry to say this, but this condition is unfortunately a normal symptom. The tumor's growth can affect certain areas of the brain, causing visual hallucinations. This shows that the disease is progressing." Sarah's face fell, and her eyes filled with tears again. "So it's not real? Emma isn't really seeing a woman?" Dr. Thompson explained using a sincere tone. "I'm sorry, but there's a medical explanation for this. Brain tumors sometimes show patients images that seem very real, but don't actually exist." At that moment, Emma's eyes slowly opened. The little girl looked around with confused but simultaneously hopeful eyes. And when she saw the Virgin Mary statue, her face lit up. "Mom, is the blue lady here? Can I talk to her?" Sarah and Dr. Thompson looked at Emma. the little girl was pointing at the statue, but her gaze was focused on the empty space next to the statue. "Emma, sweetheart, there's only Great-Grandma Esperanza's statue here. No one else is here," Sarah said, her voice mixed with worry and pain. But Emma insisted persistently, "No, Mom. That woman is here. She's standing right next to the statue. She looks very beautiful and very kind, and she's smiling at me." Emma acted as if she was turning to an imaginary friend. "Hello, I'm Emma. Who are you?" Dr. Thompson and Sarah watched Emma having an imaginary conversation. This was a worrying development for Dr. Thompson. The hallucinations were getting stronger, which indicated that the tumor was putting more pressure on critical brain areas. "Emma, try to look," Dr. Thompson said, checking Emma's pupils again with the small flashlight in his hand. "Right now, only your mom and I are in the room." But Emma insisted. "Doctor, can't you see her? The woman in the blue dress is here. She's telling me I shouldn't be afraid at all." Dr. Thompson examined Emma's pupils in more detail. The left pupil was larger than the right, and its reaction to light was slow. This was another sign of increased brain pressure. The hallucinations were also getting stronger, indicating that the tumor continued to grow. "Mrs. Martinez, I don't want to disturb you, but we need to talk privately," the doctor said, gesturing to take Sarah to the corridor. Sarah kissed Emma's forehead. "Sweetheart, I'm going to talk to the doctor for a minute. You rest here, okay?" In the corridor, night shift nurses quietly continued their work. The cry of a baby could be heard in the distance. Dr. Thompson led Sarah to a small conversation area. "Mrs. Martinez, I need to speak frankly with you," the doctor said, lowering his voice. "Emma's condition is rapidly deteriorating. Hallucinations are increasing. Neurological symptoms are getting stronger. This indicates that we're in the terminal stage." Sarah's face turned white. What do you mean?" "Emma's tumor has now spread to the brainstem. This region controls vital functions: breathing, heart rhythm, consciousness. Unfortunately, there's nothing left we can do." Sarah's breathing became labored. But you're a doctor. There must be something. Another hospital, another treatment." Dr. Thompson's own voice was constricted. "Believe me, Mrs. Martinez, I've spoken with colleagues around the world. I've researched the latest experimental treatments. But in Emma's condition, unfortunately, no options remain." Sarah leaned against the wall. Her knees buckled and she slowly sank to the floor. "How much time do we have?" she asked, her voice barely more than a whisper. Dr. Thompson swallowed hard. These were the most painful words a doctor could say. "Maybe a week, maybe less. I'm sorry." Sarah's scream echoed through the hospital corridor. She covered her face with her hands and began sobbing uncontrollably. Her body was shaking, as if all the pain and fear she had kept inside for years was coming out at once. "This isn't fair," she moaned. "She's only 7 years old. She has so much more to live for. This isn't fair." Dr. Thompson tried to embrace Sarah. As a father of a girl the same age, he could feel this pain. "You need to be here now, Mrs. Martinez. Emma needs the best things. She needs your love, your hope, your presence. But I'm not ready yet," Sarah moaned. "She's my everything. How will I live without her? How will I breathe?" Dr. Thompson's throat tightened. He had been doing this job for 15 years, but losing a child was never easy, especially a fighter like Emma, who was cheerful, hopeful. "Mrs. Martinez, you need to focus on Emma now. You need to appear strong to her, to do everything in your power to make her last days as beautiful as possible." Sarah tried to wipe her tears. "What should I do? How should I treat her?" "Act normal. Show her your love. Create beautiful memories together. And if you believe, pray." Spiritual support can be very important in these final days. When they returned to the room, Emma was sleeping again, but there was a peaceful expression on her face. The Virgin Mary statue looked almost alive in the yellow light of the night lamp. Dr. Thompson had the opportunity to examine the statue more closely. It really was a very old and carefully crafted piece. The marble quality was excellent, the workmanship very detailed. The expression on the Virgin Mary's face was so realistic that she seemed to be breathing. "Mrs. Martinez, where did you get this statue?" It's from my grandmother Esperanza. She was born in Mexico and immigrated to America at a young age. She got this statue from the Basilica di Guadalupe in Mexico City. It's very old, maybe more than 100 years old. Does it have special meaning for your family? Sarah nodded. My grandmother said this statue was miraculous. The women in our family have prayed to this statue for generations. Before she died, Esperanza told me, Sarah, in your darkest moment, pray to the Virgin Mary. She will never leave you alone. Dr. Thompson knew that his scientific mind had difficulty accepting such beliefs, but he could also see the strength that Sarah's faith gave her. This faith was the only thing keeping her standing. As the night progressed, Dr. Thompson visited the room several more times. Emma's condition remained stable, but extremely critical. Vital signs were weakening. Sarah never left Emma's bedside, constantly praying. At 1:30 a.m., Dr. Thompson entered the room for a final check. Sarah was kneeling in front of the Virgin Mary statue again. This time she was praying aloud. Holy Mother Mary, you are a mother. You know what it means for a child to suffer. Please have mercy on Emma. Don't take her to you. It's still too early. Dr. Thompson, although hesitant to witness this emotionally charged moment, was moved by Sarah's sincere faith. Even though he didn't have religious beliefs himself, he could see how much this mother's spiritual strength supported her. Emma was murmuring in her sleep, "Blue lady, so beautiful, says don't be afraid." Sarah touched Emma's hand. "What do you see, sweetheart?" Emma answered without opening her eyes. "The blue lady is singing to me a very beautiful song, and she tells me not to cry because everything will be all right." Dr. Thompson checked Emma's pulse. It had stabilized somewhat in the last few hours. This could be a sign that terminal patients were experiencing the final energy period just before death. At 2 a.m., Dr. Thompson returned to his office. He had to update Emma's file and write final reports. But when he was alone in his office, he found himself emotional. Emma's condition had affected him more than usual. Perhaps it was because of the age similarity with his own daughter Madison. Madison was also 7 years old, curious, cheerful, and full of life like Emma. Thinking about Madison drawing pictures at home, playing with school friends, made Emma's tragedy even more painful. Dr. Thompson re-examined Emma's MRI images on his laptop. The tumor had spread to very critical areas of the brain, motor cortex, temporal lobe, and most dangerously, it extended to the brainstem. There were no surgical options. Radiotherapy was no longer effective. Chemotherapy had failed to stop the tumor. Scientifically, there was no hope for Emma. At 15 a.m., Nurse Jennifer called Dr. Thompson with the emergency button. "Dr. Thompson, there's an urgent situation in room 237. You need to come immediately." But it's not an emergency medical situation. It's something difficult to explain. Dr. Thompson noticed the astonishment in Jennifer's voice. She was an experienced nurse who had been working for 10 years and didn't get easily surprised. He ran to the room. When he entered, he was shocked by the scene he encountered. Emma was in deep sleep, but there was no expression of pain on her face. Actually, she seemed calm, almost smiling. The child who had complained of severe pain the night before was now sleeping peacefully. Sarah was kneeling in front of the statue, raising her hands to the sky and praying. There was deep concentration on her face, but the most surprising thing was the Virgin Mary statue. 2 drops of clear liquid were slowly flowing from the statue's face, starting from her eyes and streaming down her cheeks. The drops continued steadily, continuously flowing. This is impossible," Dr. Thompson murmured, unable to believe his eyes. Nurse Jennifer was in the same state of astonishment. "Doctor, I was shocked when I first saw it. It's been like this for about half an hour. But look, it's really flowing." Dr. Thompson approached the statue. His scientific mind sought an explanation, but what he saw with his eyes was beyond logic. How could tears flow from a marble statue? Stone material couldn't produce liquid. He touched the statue's face with his hand. A warm, wet sensation came to his fingertips. It really was tears. But how could this be possible? The doctor examined the statue from every angle. Could there be a hidden water system? A mechanism to spray liquid from inside? but the statue was solid marble. There were no cavities, no hidden systems. "Mrs. Martinez," he said, his voice trembling, "how long has this been like this?" Sarah noticed the astonishment in Dr. Thompson's voice and raised her head. When she saw the tears on the Virgin Mary statue, her eyes filled with tears. She's crying," she whispered. "The Virgin Mary is crying. She's crying for Emma." Dr. Thompson tried to find a logical explanation. Humidity, temperature change, condensation. But none of it made sense. The temperature and humidity in the hospital room were kept precisely constant. And if it were condensation, it would be visible all over the statue, not just in the eyes. "Doctor," Nurse Jennifer said, "look at this too." Jennifer was pointing to Emma's pulse monitor. Dr. Thompson looked at the screen and was amazed. Emma's pulse had normalized. Her fever, which had been consistently high for the last few weeks, was dropping. Blood pressure had also stabilized. How is this possible? Dr. Thompson asked himself. Emma's vital signs had been continuously worsening for the last 24 hours. But now, the numbers on the monitor were returning to normal. Emma opened her eyes at that moment, but this time there was a different sparkle in her eyes. The dullness and fatigue seen in recent weeks had been replaced by a clear, lively gaze. It was as if she had awakened after a long, restful sleep. "Mom," she said, her voice coming out strong and clear. "The blue lady talked to me for a long time." Sarah rushed to Emma's bedside. "What did she say, sweetheart? What did you talk about?" Emma answered with a smile. She said, "Emma, you are a very brave girl. You fought this disease very well, and I'm proud of you. Now it's time to get better. But first your mom and the doctor need to believe in me." Dr. Thompson checked Emma's pupils with a mini flashlight. Previously unequal in size, they were now equal and reacting normally to light. Her speech was also more fluent and coherent. The neurological symptoms seen in recent weeks seemed to be diminishing. "Emma, how do you feel?" the doctor asked, unable to hide the astonishment in his voice. "I feel great. My head doesn't hurt at all anymore. And I'm very hungry. Can I have pancakes?" Emma, who had struggled to even drink water for the last 2 weeks, let alone eat, now wanted food. This was an incredible development for Dr. Thompson. Nurse Jennifer gave Dr. Thompson a meaningful look. Both had been working in this field for 15 years and had never experienced such sudden recoveries. "Jennifer, I want comprehensive blood tests immediately. Complete blood count, biochemistry panel, inflammation markers, tumor markers, and get an emergency MRI appointment." "Yes, doctor. I'll handle it right away." Dr. Thompson examined Emma in more detail. Reflexes normal, coordination good, eye movements regular. She successfully performed simple neurological tests like sticking out her tongue and touching her nose with her finger. "Emma, do you have any headache?" "No, doctor. I feel great." "Nausea?" "No, I'm just hungry." "Dizziness?" "None at all." These findings surprised Dr. Thompson even more. The child who had all these symptoms last night now appeared completely normal. At 8 a.m. During the daily shift change, Dr. Thompson reported Emma's condition to the other doctors. However, he didn't mention the tears flowing from the Virgin Mary statue. This was a detail that would risk his scientific credibility. "There's an unexpected improvement in Emma Rodriguez's condition. Her vital signs have stabilized, and I'm observing a significant reduction in neurological symptoms." Dr. Rachel Stevens, the chief oncologist, asked in astonishment, "Michael, how is this possible? Last night you said she was in the terminal stage." "I'm wondering the same thing, Rachel. We're taking her for an emergency MRI today. Could it be spontaneous remission?" Spontaneous remission in glioblastoma multiforme is extremely rare, but there's no other explanation right now. In the afternoon, when the MRI results came in, Dr. Thompson couldn't believe his eyes. What he saw on the computer screen was something not written in medical textbooks. The tumor size had shrunk by 60%. More surprisingly, the pressure on the brainstem had almost completely disappeared. This was a medically inexplicable situation. These types of aggressive tumors didn't shrink. They only grew. Dr. Thompson examined the images from different angles. Maybe there had been a technical error. Maybe the wrong patient file had been opened, but the patient's identity information was clearly visible. Emma Rodriguez, age 7. He called Dr. Rachel Stevens. "Rachel, you need to look at Emma's MRI results." 20 minutes later, Dr. Stevens came to Dr. Thompson's office. They examined the images together. "Michael, are these results correct? Did you check the date?" "I checked 3 times. This is this morning's scan. Did you compare it with the previous scans?" Dr. Thompson brought up the MRI images taken the previous week on the screen. The comparison was clear. The tumor had dramatically shrunk. "How is this possible? There's only 1 week between the previous scans and this one. A tumor can't shrink this quickly." "I'm thinking the same thing, Rachel. But the results are here. Could it be a technical error? We scanned with 2 different machines. Both showed the same result. Also, Emma's clinical condition is consistent with the MRI findings." Dr. Stevens closed the file and looked at Dr. Thompson. "Is there anything different about this case? A new treatment, experimental drug, dietary change?" Dr. Thompson hesitated. How could he explain the tears flowing from the Virgin Mary statue? He would lose credibility among his colleagues. "No, there's no new treatment. Changes in the family's lifestyle? No. Then this is spontaneous remission. Extremely rare, but not impossible." "Yes, it appears so." But Dr. Thompson knew the truth. This recovery had begun the moment tears started flowing from the Virgin Mary statue. That evening, Dr. Thompson visited Emma's room again. Emma was watching television and chatting with her mother. The child who was dying last week now behaved like a normal 7-year-old. The Virgin Mary statue still stood on the bedside table, but the tears had stopped. Dr. Thompson carefully examined the statue. No trace, no moisture residue, as if tears had never flowed. "Dr. Thompson," Emma said cheerfully, "the blue lady has a message for you too." Dr. Thompson was surprised. "For me?" Emma nodded. "Yes," she said. "Tell the doctor that sometimes miracles are as real as science. Even though he doesn't believe in me, I believe in him. And he's a very good doctor." Dr. Thompson's throat tightened. These words coming from a small child's mouth had deeply affected him, especially during a period when he was questioning his own scientific beliefs. "Emma, what else does this lady tell you?" "Lots of things. She told me that my time of being sick is over. She said I could grow up now, go to school, play with my friends." Sarah stroked Emma's hair. "Well, is that lady here now?" Emma looked around. "No, she's not here right now, but she said she'd come back. She said she'd never leave me." Dr. Thompson experienced complex emotions while listening to this conversation. His scientific training said these were hallucinations, but Emma's dramatic recovery couldn't be explained otherwise. That night at home, Dr. Thompson thought long and hard. His wife Margaret noticed how deeply he was lost in thought. "How was your day today, sweetheart?" "It was a very strange day. I experienced things I had difficulty explaining." "Is it about the sick child, Emma?" "Yes. Something medically impossible happened." Margaret touched Dr. Thompson's arm. "Sometimes inexplicable things happen in life, Michael. This doesn't mean you're a bad doctor, I know, but I've been doing this job for 15 years. I evaluate everything within the framework of science. What I saw today, they didn't conform to scientific logic." "What did you see?" Dr. Thompson hesitated. Should he tell Margaret about the tears flowing from the Virgin Mary statue? His wife was a believing woman, but would she accept such an incredible event? The child's condition improved inexplicably. Last night she was on her deathbed. Today she's almost completely normal. "That's wonderful news. You should be happy too." "I am happy, of course, but I can't understand how it happened." Margaret smiled. "Michael, you're a wonderful doctor, but you don't have to control everything. Sometimes miracles really happen." That night, Dr. Thompson couldn't sleep for a long time. He thought about the tears flowing from the Virgin Mary statue. He thought about Emma's conversations with the Blue Lady, and he thought about the dramatic recovery. Maybe Margaret was right. Maybe inexplicable things really happened. Asterisk the next day, Dr. Thompson decided to research about crying Virgin Mary statues. He searched for information on this topic in medical databases, psychiatry articles, and even paranormal research. In his internet research, He found dozens of reports of tears flowing from Virgin Mary statues worldwide. Medjugorje, Fatima, Syracuse, similar events were recorded in many places, but most were classified as miracles and couldn't be scientifically explained. One article caught his attention. Research conducted at Syracuse University examined the chemical analysis of crying statues. In most cases, the flowing liquid was found to be very similar to human tears. Dr. Thompson noted this information. Maybe he should also analyze the tears from the statue in Emma's room. During lunch break, he researched spontaneous remission cases in the hospital library. He learned that the spontaneous remission rate in glioblastoma multiforme was less than 0.05%. That is, 1 in 2,000 cases. This statistic made Emma's situation even more exceptional. In the evening, when he visited Emma again, the child's condition was even better. She was eating, trying to read books, and chatting with the nurses. Dr. Thompson, Emma said joyfully, "Today the blue lady told me very beautiful things." "What did she say?" "She said, 'Emma, now you can play outside the hospital too. You can run in the garden, but you must never separate the statue from your side.'" Dr. Thompson examined the Virgin Mary statue. It looked normal, nothing unusual. "Emma, can you describe to me what that lady looks like?" Emma closed her eyes and thought, "Very beautiful. She wears a blue dress, and she has something blue on her head too. She has very kind eyes, and when she looks at me, I feel very warm." This description was very similar to traditional depictions of the Virgin Mary. "Well, does that lady talk to anyone else? Sometimes I see her talking to my mom, but Mom doesn't answer because she can't see her." Dr. Thompson looked at Sarah. "Mrs. Martinez, do you feel or see anything unusual?" Sarah nodded. "Sometimes I feel a different warmth in the room, and sometimes I feel like someone is watching me, but I don't see anything." Dr. Thompson was now determined to get to the bottom of this event. The next night, even though he wasn't on duty, he came to the hospital. He talked to night shift nurse Jennifer. "Jennifer, let's closely monitor room 237 tonight. We need to make more detailed observations to understand the change in Emma's condition." "Of course, doctor. Emma's recovery is something we nurses are very curious about too." At 1 a.m., Dr. Thompson and Jennifer went to Emma's room. Sarah was praying in front of the Virgin Mary statue again. Emma was in deep sleep. At 2:30 a.m., what they expected happened. Tears began flowing from the Virgin Mary statue again. This time Dr. Thompson was prepared. He recorded the video with his phone. Jennifer also witnessed it. "Jennifer, put a sterile container under the statue. I want to analyze that liquid." Jennifer brought a sterile container from the operating room supplies and placed it under the statue. The flowing tears collected in the container. Dr. Thompson measured the temperature of the flowing liquid. 37 Celsius, human body temperature. This was very significant, because marble should have been at room temperature, not body temperature. At the same time, they checked Emma's vital signs. Pulse, blood pressure, and breathing. All were in ideal ranges. When the liquid stopped flowing, Dr. Thompson sent the sample to the hospital laboratory. He requested urgent analysis. The next morning when the results came, Dr. Thompson experienced a great shock. The analysis report read, sample 99.7% compatibility with human tears, sodium, potassium, protein, and lactoferrin levels within normal human tear values. No chemical additives or artificial substances detected. This result showed that the liquid flowing from the Virgin Mary statue was real tears. But how was this possible? Dr. Thompson called the laboratory technician. "Mark, are these analysis results correct? Did you double check?" "Yes, doctor, we tested twice. The result is definitive. This is real tears." The situation had shaken Dr. Thompson's scientific world. How could human tears flow from a marble statue? That evening, Dr. Thompson had a long conversation with Sarah. "Mrs. Martinez, I'm going to ask you a very strange question. Have you had such experiences with this statue before?" Sarah thought, "Actually, my grandmother Esperanza once told me this statue was special. One night when grandfather was very sick, she saw the statue crying." "What happened then?" Grandfather recovered the next morning. The doctors couldn't explain it, but his illness completely disappeared. This information was even more surprising for Dr. Thompson. Could Emma's situation be a repetition of an experience previously lived in the family? Is anyone else aware of this? Only the family elders, but most have passed away now. The statue is our family's most precious heritage. That night, Dr. Thompson told Margaret everything. The Virgin Mary statue, the flowing tears, Emma's recovery, the laboratory results. Margaret listened with an astonished, but also fascinated expression. Michael, maybe this is an experience for you to learn the limits of science. What do you mean? You're a wonderful doctor. You've helped so many patients. But maybe some things are bigger than what science can explain. Do you believe this? Margaret smiled. I believe it. And deep down, you believe it too, don't you? Dr. Thompson remained silent for a long time. Then he nodded. Yes, I think I believe it. In the following days, Emma's condition continued to improve. New MRI scans showed that the tumor had almost completely disappeared. Blood tests were perfect. Neurological examinations were within normal limits. Medically, Emma had completely recovered. Dr. Rachel Stevens wanted the case to be officially recorded in medical literature. Michael, this is an extraordinary spontaneous remission case. We must publish it. Rachel, there's more than spontaneous remission in this case. What do you mean? Dr. Thompson hesitated. Should he tell his colleague about his experiences with the Virgin Mary statue? Emma's recovery may be connected to non-medical factors. What kind of factors? Spiritual factors, faith, prayer, maybe even miracle. Dr. Stevens was surprised. Michael, you never looked at life this way, I know. But what I saw in this case changed me. That week, comprehensive tests were conducted regarding Emma's recovery process. All results showed the same thing, complete recovery. When Dr. Thompson wrote his final report on Emma's condition, he used the diagnosis of spontaneous remission, but he added this to the notes section. In this case, it is evaluated that the patient family's strong spiritual faith contributed positively to the healing process. A month later, Emma was discharged completely healed. The Virgin Mary statue was carefully packed in her bag. Dr. Thompson, Emma said when being discharged, "The Blue Lady thanks you." For what? For believing in me and letting go of the pain, and for not forgetting this lesson when helping other patients. Dr. Thompson hugged the little girl. Emma, you taught me very important things. What did I teach you? That sometimes miracles that science can't explain can happen. Months later, Dr. Thompson had adopted a different approach in his pediatric oncology practice. He still worked with the same scientific rigor, used the latest technologies, and applied proven treatment methods. But at the same time, he also gave importance to the spiritual needs of patients and their families. Hospital management supported Dr. Thompson in developing a holistic treatment approach. Now, alongside religious leaders providing chaplain services in the oncology ward, complementary medicine specialists also worked. Emma's story spread very quietly but effectively. Dr. Thompson began giving presentations on the role of psychospiritual factors in pediatric oncology at medical conferences. At one conference, a young doctor asked, "Dr. Thompson, do you really believe in miracles?" Dr. Thompson smiled. "I believe in recoveries we can't explain. Whether you call it a miracle or spontaneous remission, what matters is that we give our patients hope and support." 2 years after her recovery, Emma continued her life as a normal child. She went to school, played with friends, and dreamed. The Virgin Mary statue still stood in a special place in her room. Sometimes when friends saw the statue, they asked, "What's that, Emma?" Emma proudly explained, "This is my guardian angel. She helped me when I was sick." Sarah, even though she believed her daughter was completely recovered, didn't neglect regular checkups. Every checkup reminded them of that night when they saw Dr. Thompson. "How is Emma's condition?" "Doctor, perfect, Mrs. Martinez. We don't encounter any problems." Emma sometimes asked Dr. Thompson, "Doctor, do you sometimes see the Blue Lady?" Dr. Thompson answered honestly, "No, Emma, but I feel her presence." Dr. Thompson's case study about Emma was published in the Journal of Pediatric Oncology. 6 months later, the article, Titled Spontaneous Remission in Pediatric Glioblastoma, a case study with psychospiritual considerations, became one of the most downloaded papers in the journal's history. The medical community's reaction was mixed. Some colleagues praised Dr. Thompson for his honest approach to documenting an unexplainable recovery. Others criticized the inclusion of spiritual factors in a scientific publication. Dr. James Morrison from Harvard Medical School wrote a response letter. While we must document rare cases of spontaneous remission, we should be cautious about attributing them to non-scientific factors. Dr. Thompson replied, as physicians, our duty is to heal the whole person, not just the disease. If spiritual support contributes to healing, we should acknowledge it, even if we can't measure it. The debate continued in medical journals for months, but Dr. Thompson didn't mind. He had witnessed something that changed his understanding of medicine forever. News of Emma's recovery began attracting families from across the country to St. Mary's Children's Hospital, not because they expected miracles, but because they heard about a place where doctors treated both the body and the spirit. Dr. Thompson established a new protocol for terminal pediatric cases. Along with medical treatment, families were offered counseling, spiritual support, and what he called hope therapy, helping families maintain optimism while being realistic about outcomes. The hospital's chapel, once rarely used, became a gathering place for families of all faiths. Dr. Thompson often visited, not to pray himself, but to offer support to families in their darkest hours. One day, a mother of a child with leukemia approached him. Doctor, I heard about the little girl who recovered here. My son asks if miracles still happen. Dr. Thompson knelt to the boy's level. What I can tell you is that hope is powerful medicine, and sometimes things happen that we can't explain, but that doesn't make them less real. 5 years after that night, Dr. Thompson had become one of the most sought-after pediatric oncologists in the country, not because his cure rates were higher than others, but because of his approach to patient care. Emma, now 12, visited him annually. She had grown into a bright, compassionate girl who wanted to become a doctor herself. Dr. Thompson, she said during one visit, I still see her sometimes. The blue lady, yes. She doesn't talk as much now, but she smiles at me. I think she's proud of how I've grown up. Dr. Thompson nodded. What do you think she wants you to do? Emma thought carefully. I think she wants me to help other sick children the way she helped me. But not just with medicine, with hope. The Virgin Mary statue remained in Emma's room, now surrounded by academic awards, photos with friends, and dreams for the future. But it remained the centerpiece, a reminder of grace in the darkest hour. Dr. Thompson began mentoring medical students differently after Emma's case. During their rounds, he would stop at the bedside of terminal patients and ask his students, what do you see? A dying child. One student might answer, look again. Dr. Thompson would say, I see a human being deserving of dignity, comfort, and hope until their last breath. Medicine isn't just about curing. Sometimes it's about caring. He established the Emma Rodriguez Fellowship for medical students interested in integrative pediatric care. The program combined traditional medical training with courses in psychology, spirituality, and what Dr. Thompson called the art of presence. The first recipient was Dr. Sarah Chen, who had been inspired by Emma's story. Dr. Thompson taught me that being a good doctor means being open to mysteries. She said at her graduation, some healing happens beyond our textbooks. On the 5th anniversary of Emma's recovery, Dr. Thompson received an unexpected letter. It was from Dr. Antonio Castillo, a pediatric oncologist in Mexico City. Dear Dr. Thompson, the letter read, I have been following your work since your publication about the Rodriguez case. I am writing to tell you about a patient of mine, a 9-year-old girl named Maria, who has been praying to a statue of Virgin of Guadalupe. Yesterday, her tumor showed inexplicable regression. I found tears on the statue's face. I thought you should know. You are not alone in witnessing these events. Dr. Thompson stared at the letter for a long time. Then he carefully filed it in a special folder he had created, Unexplained Recoveries. The folder was getting thicker. He never sought out these cases, but they found him. Doctors from around the world wrote to share similar experiences, moments when medicine met mystery, when hope became healing. 3 years later, Dr. Thompson was invited to speak at the International Conference on Integrative Medicine in Barcelona. His presentation was titled Beyond the Visible: Incorporating Spiritual Care in Pediatric Oncology. The auditorium was packed. He told Emma's story, careful to focus on the medical aspects, but honest about the unexplainable elements. "I have learned," he concluded, "that admitting we don't understand everything is not a weakness, it's wisdom. Our patients and their families often experience realities that our instruments can't measure. Our job is not to dismiss these experiences, but to honor them." During the Q&A, a doctor from India stood up. "Dr. Thompson, has this experience changed your own spiritual beliefs?" Dr. Thompson paused. "I can't say I've become religious in any traditional sense, but I've become open to possibilities I once dismissed. I've learned that mystery and medicine can coexist." When Emma turned 16, she announced her intention to study medicine, but she surprised everyone by choosing to specialize in pediatric oncology. "Aren't you afraid it will bring back difficult memories?" Sarah asked her daughter. Emma shook her head. "Mom, those memories aren't difficult anymore. They're my mission. I want to be there for other children the way Dr. Thompson was there for me." She applied to pre-med programs with essays that spoke of hope, healing, and the importance of treating the whole person. Harvard accepted her early admission. When Dr. Thompson heard the news, he invited Emma to observe his rounds. She watched as he interacted with patients, noting not just his medical expertise, but his presence, his attention to the spiritual needs of families. "You're different from other doctors," Emma observed. "How so?" "You see people, not just diseases. You give them permission to hope even when science says there's no reason to." Dr. Thompson smiled. "You taught me that, Emma, you and a small statue that cried real tears." Dr. Thompson's career culminated in his appointment as Chief of Pediatric Oncology at St. Mary's Children's Hospital. His first initiative was to establish the Center for Integrative Pediatric Care, which combined cutting-edge medical treatment with emotional, psychological, and spiritual support. The center's chapel was redesigned to welcome families of all faiths, with quiet spaces for prayer, meditation, and reflection. At its heart stood a small garden, where families could plant flowers in memory of children they had lost, or in celebration of those who had recovered. Emma's tree, a dogwood that bloomed every spring with white flowers, stood at the center of the garden. A small plaque read, "In celebration of Emma Rodriguez and all the children who teach us about courage, hope, and the mysteries of healing." On the 10th anniversary of Emma's recovery, St. Mary's held a special ceremony. Emma, now a sophomore at Harvard studying biology, spoke to an audience of doctors, nurses, patients, and families. "10 years ago, I was dying in room 237, she began. "The doctors had done everything they could. My mother had prayed every prayer. She knew, and then something inexplicable happened. I recovered." She looked directly at Dr. Thompson in the audience. "But the real miracle wasn't my healing. It was watching a doctor learn to believe in things he couldn't measure." Dr. Thompson could have dismissed my recovery as a statistical anomaly. Instead, he allowed it to change how he practiced medicine. Emma paused, looking at the faces in the audience, current patients, survivors, families still in the midst of their battles. Whether you call it a miracle, spontaneous remission, or the power of prayer doesn't matter. What matters is that we remain open to hope, even when logic tells us to despair. And we remember that healing sometimes comes in forms we don't expect. The audience gave her a standing ovation, but Emma's eyes were on a small girl in the front row, bald from chemotherapy, clutching a stuffed animal. Emma winked at her, and the girl smiled back. Dr. Thompson retired at 65, having served as chief of pediatric oncology for over a decade. His final patient was a 6-year-old boy named Lucas, who had been battling brain cancer for 2 years. Lucas's grandmother had brought a statue of St. Jude to his hospital room. On Dr. Thompson's last day, he found the elderly woman praying beside the statue, just as Sarah had prayed beside the Virgin Mary years earlier. "Doctor," the grandmother said, Do you think saints still listen to us? Dr. Thompson sat down beside her. Ma'am, in my experience, love always listens. Whether it comes through saints, prayers, or just the hope in a grandmother's heart, it's always listening. That night, as Dr. Thompson cleaned out his office, he found the folder labeled Unexplained Recoveries. It now contained reports from dozens of doctors worldwide, cases where medical science met mystery, where hope became healing. He thought about Emma, now in her second year of medical school, already accepted into a research program studying the connection between emotional well-being and physical healing. He thought about the thousands of patients he had treated, some who recovered, others who didn't, but all of whom had taught him something about the human spirit. As he locked his office for the last time, Dr. Thompson reflected on the night that changed everything, the night he touched a marble statue and felt warm tears on his fingertips. He had never been able to explain it scientifically, but he no longer needed to. Some things he had learned were too sacred for explanation. They could only be witnessed, honored, and shared. And somewhere in Boston, Emma Rodriguez was studying. Late into the night, preparing for her organic chemistry exam. On her desk, beside her textbooks and notes, sat a small white marble statue of the Virgin Mary. The statue was silent, motionless, ordinary. But to Emma, it would always be so much more. It was a reminder that love never abandons us, that hope is stronger than despair, and that sometimes, in our darkest hours, grace arrives in the most unexpected forms, even tears from a marble statue.